Welcome to tonight's webinar from Brown University School of Professional Studies. I'm Sandy Ferretti, and I'm the Program Director for the Master of Science in Healthcare Leadership here at the School of Professional Studies. I want to start with the mission of Brown University is to serve the community, the nation, and the world by discovering, communicating, and preserving knowledge and understanding in a spirit of free inquiry. The Masters of Science in Healthcare Leadership at Brown School of Professional Studies is guided by that mission and seeks to develop healthcare leaders for the future. In the spirit of serving our communities, the nation, and the world, we're excited to be launching this series titled Lessons in Leadership, Let's Talk Healthcare. These sessions on leadership will cover a wide variety of topics delivered by academic leaders and executive practitioners in the field. These sessions are open to anyone who would like to join us, so please invite your colleagues and team members to future sessions. All of our future sessions are listed on our website. Tonight's session is titled New Leadership Competencies for a Pandemic World. So let's get to it. I'd like to introduce you to Professor Henry Browning, an adjunct lecturer of health services policy and practice at Brown University and former design faculty at the Center for Creative Leadership. Henry has been coaching and providing leadership development training across industries for 25 plus years, and we're honored to have him as part of the MHL faculty. Kelly Doyle is a nurse and is CEO of the Rothman Orthopedic Specialty Hospital outside Philadelphia, Pennsylvania, and a 2019 graduate of the MHL program. You will hear from both our guest speakers, and then we'll open the session to questions and answers. Please put your questions in the Q&A section of your Zoom menu bar. With that, I'm going to turn it over to Henry, and thank you all for joining us.
What the title of this topic kept coming up with a lot of different things. When we first started talking about it, we wanted to talk about, the post-COVID world. How's leadership different in the post-COVID world? But then we recognized that COVID's not over. COVID's not over in the long shot. And so I was coming up with new titles: a COVID-infused world, COVID-exhausted environment, a COVID-depleted world, or really collaborative healthcare, overcoming COVID fatigue, or really the new COVID reality. And maybe it won't be COVID in 5 years, but it's going to be something. I think we're experiencing a brand new world where world events, world pandemics, world health issues are going to become a larger focus of healthcare, and how do we overcome them. So I would welcome any new titles you have for what it feels like to live in this world of confusion, and where do you go for the right answers. For what we've been studying at both Brown University and in my previous organization, the Center for Creative Leadership, we really wanted to talk about the fact that there are no single set of leadership competencies anymore for dealing with this complexity. Leadership is so contextual, and so COVID has given us a brand new context to try to understand how to be effective. So if we can't find good competencies, what we're asking, or what we're finding, is we have to start focusing on agreed upon outcomes. And that's helping to bridge or create collaborative entities to solve these complex problems. So these collaborative outcomes, it is about creating a shared purpose or a shared vision. I used to think it was about shared direction, but direction was too nebulous. I really think that in healthcare, it is about connecting having that shared purpose that's so critical. And I think we can all agree that quality, compassionate patient care is why healthcare exists. What we found in the past as many organizations, healthcare organizations, suffered from too much siloism, too much working in separate functions, disciplines, departments. And nowadays we're having to really cross over these different functions, these different departments, these different regions, because COVID, it's in every portion of the hospital. So it's not just in a separate division that needs to be taken, that's where we take care of it. So I think integration of roles and functions and departments is now becoming the new norm. And in the end, I think accountability is now becoming more important. And it's not accountability to actually find who is at fault. It's accountability to learn what people are doing. So really a positive accountability. We want to find out who's doing it or what mistakes they made so that the next organization can make it better. So it really is about learning and being accountable for our actions and learning from those actions and then taking that. So it's not just about a person being accountable, accountable. It's about how does an organization create a culture of accountability so that we can learn fast and implement new ideas in living in this brand new world of healthcare. So I just spell these out a little bit more clearly, but the idea is it is about staying focused and constantly asking that question of shared purpose, constantly looking about how do we integrate across disciplines of medicine or disciplines across departments and hospitals so that no ball gets dropped. That's usually the issue is the patient gets transferred over, or a challenge or a process is about connecting it across the system, and we drop the ball at these crucial handoffs. So it's about knowing my job and how it fits into the bigger scheme of things. And again, accountable at the org level, not just for my job. It's crucial that we start getting people to talk about accountability for the whole process, the whole patient care process. So we started looking at leadership cultures in healthcare, and I guess it used to be okay to be in, if I look at healthcare and some of the studies we've done for the last 25 years, there's a lot of authority structures inside of healthcare. And sometimes those authority structures have a hard time of working and communicating across or getting things to move quickly. Decisions are slow. So we went to a real independent model. But I will tell you a story, personal story of how my father-in-law, who had pancreatic cancer, it couldn't get agreement between his endocrinologist, his oncologist, and his neurologist about when he should be, discharged from the hospital. And it was really an emergency situation. So we really have to start moving past these independent, specific heroes trying to solve a problem to really move to this collective culture. So now we really do need this collaborative world, this collaborative decision-making, this collaborative dialogue to come up with better answers that we didn't have before COVID. We didn't need these kinds of answers before COVID, but now we really need them to make sense of all this complexity. So we've been putting together a model talking about maybe some major areas of focus for collaborative healthcare. And I still want to come back to the two core pieces, which I think are so critical. The outcomes, quality, compassionate care, that no matter what job we hold within a healthcare system, this has got to be our core outcome. And we sometimes get lost in the complexity. So how do we keep bringing it back to that quality, compassionate care as the outcome? And to do that, again, you're seeing me just keep repeating this shared purpose, integration, and accountability. These are the outcomes that leaders have to keep focused on throughout the entire process. But if we kind of start thinking about the big pieces of healthcare, obviously a focus is at the patient care team. What's happening at the team level right there? How are they needing to be different in this post-COVID or this new COVID reality? What needs to be happening so that we're staying on top of all the issues? Because we don't want our patients readmitted back to the hospital. We have to be focusing on getting it right the first time. So that's critical for us. How do we assess that and make sure we're staying focused on right at that bedside table, bedside touch point? The other thing that's always tough about this is the patient care team has gotten a lot more complex. It's not just who's in the hospital. It's not just who's in the family physician office. It's now, it's the web, it's the specialists, it's alternative medicine, it's the mental health piece. It's also Walmart, it's CVS, it's these minute clinics that are out there. And so the patient care team has gotten very, very complex. And we're not always clear on how the patient is getting her data or his data or their good information. So I think we have to really start thinking about a much more complex view of the patient care team. That's just critical that we start engaging them and getting them to think about that, make it a learning process. I think resource stewardship is now so many stories in healthcare where all of a sudden regular patients couldn't use the hospital for various things because all of a sudden all the resources were going to COVID patients. And how did we not really understand that dynamic until way late in the process? So it really is about boundary spanning, transparency, and facilitating across groups to make sure that we're getting patient care to everyone who needs it, as opposed to all of it being drawn into this critical, challenge of COVID. So better planning, better thinking. Now that we can see the hindsight, beautiful, but we need better models for understanding resources as we get to a resource constrained world as opposed to a resource rich world. So new leadership has got to be tackling this right up front. I think talent, well, I'm coming from the talent arena anyway, so there's probably more on this slide than you should, really read, but that's because I think we've got to start thinking about talent very differently. As we read stories about traveling nurses making as much money as physicians, it just speaks to that nursing shortage that's out there. And again, we keep reading about physician burnout at early ages like 42, and these are critical resources that we're not paying attention to. So leadership needs to change. About 15 years ago, the American Medical Association approached my organization to say, have we been teaching doctors all wrong over these years because of these issues? And I think we really are wanting to come together and start teaching doctors how to be good collaborators as opposed to being that single star performer, because they have the opportunity to lead in a much more complex world, and they need to understand the world outside of their specialty, how it connects in. So I think we are still talking some competencies like self-awareness, leading employees, participative management, building and mending relationships, having that broader perspective, and building that team, being able to build that team. You no longer get to lead a team in healthcare. You're on 100 teams. You're a member of them, you're leading them. They form overnight, they solve a problem, they disband, some go on forever. But the idea is it's about teaming these days as opposed to about being a team leader. And so we're really trying to expand that mindset of helping people kind of understand how do we do that. So we definitely need this focus on teaching our talent, giving them new skills, new abilities, new mindsets to stay present in this more complex world. I think the military gave it the best. I love this bucket, but capacity for complexity and change. It just the rate of change in healthcare. Well, it's huge in every industry, but it just seems to be so much more difficult. I remember talking to a chief nurse one time saying, "I don't have time to learn leadership because I'm having to teach the next hand washing protocol, and so we're spending so much time on just keeping up with the science. We're not having time to do leadership stuff." And I think that's a reality that's tough out there. And how do we start to create some space so we can have these leadership conversations in the middle of staying up to speed on all of the latest technical advances that are coming our way, especially as COVID, new policies were coming almost every day, new protocol, new operating procedures, all coming every single day. And how do you lead in that kind of rapid environment? The military gave us that term VUCA, the volatile, uncertain, complex, ambiguous world, and yet this, I think we live it in healthcare more than many other industries. We live it in at several different levels. So huge things that we need to be doing. And I think that maybe the competency is, can you see the connections? Sometimes we get so focused in our area, we don't even see that there are bridges, there are connections. How do we bridge these disciplines? And then how do we really collaborate systemically rather than it's just me? We got to create more collaborative systems inside of healthcare in order to solve some of these problems faster. We just can't afford to waste the resources or time given the challenges that COVID brings us. So that's some of the research we're trying to get deeper into and understand. And we are looking at transforming the culture of healthcare. I think that's one of the key things here is we really have gotten into a brand new world. And if we don't think about how a healthcare system needs to be different in order to solve or stay abreast of all these challenges and changes, we really are going to fall behind and provide less than quality care. And that's what we're trying to prevent. How do you really stay on target and deliver that quality, compassionate patient care at all times? And that's critical. So the research was pretty clear. We worked with about 20 different major hospital systems, and we worked with about 3,000 doctors in surveys to kind of gather this data around this model. And the one element that was kind of embedded but never really showed up really well was this last one. And I kind of hinted about it already, but I think engagement and well-being. How do we in healthcare, sometimes some of the people that are most out of shape are the physicians and the nurses, because they give so much every day to the job that they sometimes have a hard time taking care of themselves. So this didn't really come out as a clean outcome that physicians and nurses and administrators were struggling with, but it seemed to be an underlying theme around talent, around resources, around the care team, around complexity, constantly looking at how do we help our physicians and our nurses and our staff bring their best self to work every single day. You're seeing resilience. You're seeing a lot of these issues around empowerment, around well-being. How do we help our doctors and nurses not only be healthier and take care of themselves so that they do become a powerful resource for us for life, but at the same time, they are the role models for healthcare and helping us all really look at what's the best way to utilize healthcare and to be a person in the system who's doing their best to stay healthy, given all the science, given all the information we have at our fingertips. So this is just an overview of some of the research, some of the work, some of the mindsets we're trying to change in healthcare, given the COVID, where the current class at Brown is actually taking some 10-year-old research and updating it for us to say, what does it really feel like today? But I think the powerful part, if I can leave you with these last two pieces, it really is a simple model, is we have to be looking at these outcomes and make them daily questions, daily statements around, are we unclear about the purpose? Are we working to integrate our processes? Are we being accountable for resources, for our staff, for our patients, for the proper use and the proper following of policy and procedure and protocol? Are we accountable so that we really do bring our best self to this challenge of providing quality, compassionate care? So thanks for just paying attention to this little bit of an introduction. I'm really happy that we have Kelly here working with us, who's actually been on the ground in the middle of COVID as a CEO of a hospital, to give us some insight from the trenches, from the field of what were the complexities, what were the decisions, how did people do it, how did you navigate? So I'm going to turn it over her real quickly and let her start telling you what it feels like in the trenches, doing the actual work of leading an organization through a COVID crisis like we've just finished, or we're continuing to work through. So Kelly, I'm going to turn it over to you if we can.
Thank you, Henry. That was a great presentation. I love some of the major points that you hit there. I have to laugh. Well, first, let me thank Sandy and the faculty and everyone at Brown for inviting me. I'm thrilled to do this and honored to be a part of this. You know, Henry, you talked about the military and comparing to the military. And I remember years ago, I had a conversation with one of my surgeons about how healthcare should run and what it lacks. And he said to me, and he was a military, retired military surgeon. And he said, Kelly, the only, group that can run like that is the military. You can't run a hospital like, I thought, why not, right? But it's interesting that you make that point. However, getting back to, I am the CEO of an orthopedic hospital, and it was interesting. I was in a different dynamic because we do not have an emergency room, so we did not take care of COVID patients. However, on the flip side of that coin, it offered us the ability, while everyone was shutting down and limiting their orthopedic cases, to continue to do so for urgent and emergent cases. And I think there's different points of the pandemic that presented, of course, different challenges. And I still think about the initial phases of the pandemic. It happened so quickly. And it was unprecedented, right? So none of us had anyone to pick up the phone really and call. I tried to pick up the phone and call a lot of people. However, no one had the answers, right? So no one had been through this. So you really had to figure it out. And as a leader, how do you figure things out? And I think that's, how a lot of people got through this. And for me, I remember having a conversation, and there were some other specialty hospitals that were going to close their doors and shut down for those 2 weeks, which turned into a couple months, right? And I remember my chairman saying, we still have cases that need to get done. Like, a a spine that is losing function needs to get done right away, right? And he said, this is a big decision. It's gonna, make like, he said, it's gonna make or break you. And I no pressure, Kelly. And I thought to myself, and I did pick up the phone and I did call people, because still to today, I have a list of mentors that I continue to call, right? You never know it all. And I also, once I handle something, if it's a big critical situation, I'll reflect on it and call my mentors to see if I could have handled it differently or how they would have handled it. I was calling people and everyone just was saying to me, I don't know what to tell you, So prior to the CDC or anyone really saying, mask, wash your hands, screening and all that, I thought, well, I have to make a decision here. And, you have to decide. That's when you're prioritizing becomes critical, right? It's always very important, but critical during the pandemic. And my first priority, I know we can keep patients safe because we've done it. We have a proven track record of doing it. However, in this in this landscape, can I keep my employees safe? That was my concern. That was my number one concern. So first I had to be able to answer the question, how do I keep my employees safe? Can I keep my employees safe? And then when I figured that out, and when I say I mean we, because I have a team of people, and I love how you put emphasis on that as well, Henry, because it's not about that one person at top. For me, it never has been. I rarely make a decision without pulling my team into a room and brainstorming. I want everyone's opinion around the table. And by design, I have people around the table that all think differently, right? So that was the first thing I had to answer. How do I keep people safe, employees? And how do I message it so they trust me that they will be safe? And that, I think being a CEO at that organization for 10 years at that point, I had the majority of the people's trust, right? Otherwise, I don't think they would be working there. But I had to believe it. So I had to figure it out. So I decided, let's shut it down to one entrance. Let's start screening. If people don't feel well, let's encourage them not to come in. Whereas that wasn't the norm, right? People are afraid to call out sick. Now you're encouraging people to call out sick. Big shift in how you would normally manage, right? And we did it, and we were successful, and we were very successful. We actually were busier because a lot of the spine volume and urgent emergent volume where they were not doing in other hospitals came to our hospital because they were taking care of COVID patients. So we could essentially provide somewhat of a, not a guarantee, there's no guarantees in life, right? However, a higher probability that you will not be exposed at our hospital. So we never shut down. We did get busier. The staff, they were amazing. I think constant communication from the leadership team was important, just so that they knew that every step of the way, how we were thinking, what we were doing, the what ifs. And again, you said in your presentation, Henry, I would say more than every day, not even every day was the message changing. You could start the day with one message from the CDC, and by 4 o'clock, it was a different directive. So how do you, even staying on top of that? So, I mean, my director of nursing and my director of quality were checking that site hourly, for months and months, right? So just trying to get as much data as you possibly could, even though historically we didn't really have that much, right? Running a business. And I think the thing about healthcare in particular, and even today, if you are listening to a podcast or you pick up, you're watching the news, you pick up you're reading, I was going to say a paper, which ages me, but you go on your phone and you're reading the news, right? You'll read about Amazon or different companies that kept going, the restaurant business kept going. And healthcare, they're not talking about that so much. So I'm glad that we're doing this because we were all affected. But I know that a lot of my friends and family were all working from home, and my hours doubled, my staff's hours doubled, the stress doubled. And that's the other thing I have to point out that I think was one of the major changes when you talk about prioritization is normally on a given day, I don't think as much as you care about your employees, you care and you have systems in place to take care of your employees. But on a daily basis, we were in touch and in tune with what was going on with the employees, their mental health, their families, situation. Whereas normally you're not so in tune to that. But to keep them safe and healthy and in a good mental health space, we also had to worry about all of that. Because, if you have someone who's taking care of elderly parents and worrying about them getting COVID, or even living with you, you're afraid to go and bring COVID home to them. I mean, there's just 1,000 things that you really never thought of in your management of running an organization, a hospital, that you had to think of. And the things that you thought were important before, they became very low on the priority list, and they're the things really that you have hardwired, right? You think about them every day, but they're hardwired. And every so often you have an outlier, you tweak a process, or you put something under the microscope. The things that we worried about every day they were at the low end of the list. We had a whole new set of problems that we never dealt with before. So I think just, for me, I was very challenged, and Sandy knows this about me, I'm pretty headstrong and I'm pretty decisive. It was very difficult to be as decisive as I normally am when I did not have any data, right? So a true leader, though, even though you don't have the end true answer, you have to really be able to critically look at the pros and cons and make a decision and execute. And it's in the execution. But once I make a decision as a leader, the execution's easy for me. It's just making that decision. So I think that's where a lot of people in leadership in healthcare really struggle, because you'd never want to be wrong. You never want people to get hurt. The only reason we're here is to keep people from getting hurt and keeping people safe. And we didn't know really what the outcome was going to be. So I am happy to say I'm still working. I'm still here. I'm still in the game. I think a lot of people, and I predicted this. I said, I predict people in healthcare, if they have an opportunity to get out, they may get out. And we did see that, right? We saw a lot of people leave healthcare, and people who you really did not see before the pandemic stressed. You saw stress. If you weren't stressed and it did not touch your mental health in some way, you were not paying attention. So execution, knowing what the priorities are, keeping people safe. It was difficult. I learned a lot. I continue to put it under a microscope, because if we did not learn a million lessons from the pandemic as leaders in healthcare, then we missed out. There's a lot to learn, and we still have a lot to learn. I love a good challenge, but this is once in a lifetime. I don't need another one like that, but I'll continue to learn, so.
Biggest lesson, Kelly, what would you say, how do you lead different today, given that things have settled down a little bit? How do you lead different today than you maybe did in 2018? I'm just curious. What's different? Of course, you came to Brown in 2019, so maybe I should say since you graduated from Brown in your master's program.
I think I was, like I said, I was always very decisive. I'm able to make a decision quickly. And in all my personality tests, like the Myers-Briggs, that always comes out. I am very decisive. Even though I had to be decisive, of course, continue and execute quickly, I think it taught me to reflect a little more and to have more conversations and more input, to be quite honest. That's my style anyway. However, if I could sleep on it, I did. If I could take time, if I had more time to talk to more people, I did. And I think that's probably going to stay with me because I found it very beneficial to have as many conversations as you can possibly have and as much input from people who are seeing things at a different angle. In fact, I had a situation that it was, I don't think I have the time to get into, but it was a critical situation during the pandemic where we came in on Monday morning and it was that weekend we had the riots in Philadelphia. And a lot of my staff lived right where those riots were happening. And something happened in one of my departments and I immediately shut down the department, which in essence shut down the whole schedule and the whole operation. And I said, we will not, and if the surgeons are not happy, they can call my phone, but I need to get this whole department in a room and I need to shut this down because, the thing is, in that moment, I didn't know if I was making the right decision, if I were going to be sensitive to some people or not sensitive and for the other side, but I couldn't worry about that because I had to worry about what's our job? Our job is there are people going on the operating room today to get fixed and everyone has a critical role in making sure that that patient has an optimal outcome. And with the distraction of what was happening in that department, that would not have been able to happen, just not. They were too distracted and it was too heated and everybody was very raw from the weekend. So I shut it down and I had a conversation. And although in one respect, I couldn't relate exactly to the offended side of the fence, I was vulnerable in such that I compared it to vulnerable situations I've had in my own life that they could relate to in that situation. And I just said, this is our safe place for 8 hours. So we will deal with this. We will not deal with this while everyone's nerves are raw because I need you to be 100% focused. And I'm driving home that night and I didn't know if I handled that the right way. I really questioned myself because it was a big deal. And I called one of my colleagues from Brown because he was always the person in the room. Sandy, it was Ace. He was always the person that challenged me. He challenged me on my thoughts and my approach. And it was great. It was professional, but he always he forced me to think about things differently. And I called Ace that night. And of course he disagreed with the way I handled it. Absolutely 100% disagreed with me. Told me he would have walked out and quit, and then we had some good conversation and I took his advice and I called the employee at home that night. And at the end of the day, I would have handled it the same way. Ace would have handled it a different way, but it was great to have Ace to call and talk to and another professional who I know a lot of times we see things differently and would handle things differently, but it was great to get that input.
Exactly.
Yeah.
So we're starting to get questions in the Q&A. So I'd love to turn to some of those. So for Kelly, how do you inspire other nurse leaders considering what we would call pandemic fatigue? Like we've been at this for 2 years. Like how do you inspire your leadership team?
So humor. And it's, one of the things I wrote down that I think we all had nervous breakdowns during this pandemic. And my office was always a safe place to come in and say whatever you wanted to say, cry, do whatever you wanted to do. But humor saved us. And we trust each other and we're a tight team. And we had to inject humor in our day to get through it. And then, if there were just one-offs where someone was having a tough day, I had tough days and they helped me. there were days where, like I said, I put my head on the counter and cried. We just supported each other. We had each other's backs, and it was okay. You almost had to encourage, go ahead, have a nervous breakdown, because rightfully so, and I just think having someone or a group of people that, support you and you can go to, even, because at that time, like I said earlier, to my point of worrying about people's families and mental health at home and their kids and so many challenges. We're worried. We're trying to figure out if we can open up a daycare. When would you think that, right? Is there any way we'd have space to open a daycare or a dog? Had people working long hours, and then their schools were closed down. What are they going to do with their kids? So it was so stressful, so I would say there's a lot of different answers to that question, but the main thing is to be able to be comfortable and make sure you keep finding something to smile about and laugh about. And we did that every day. We would have gone nuts if we did not.
Right.
It does feel like, Kelly, you gave permission to go nuts for a moment, and then that helps people get back to normal sooner because they weren't trying to stuff it inside for too long. So that's very
100%.
powerful.
Yeah.
Very powerful.
All right. So Joe Hart, Dr. Hart has a question for Kelly, one of her classmates. He asks about what do you think the long-term impacts on the surgical OR workforce will be from the pandemic, and why is that continuing to accumulate now that we think we've gotten past the peak of COVID?
So I would say, great question, Joe, you as usual. I would say that what will continue, what the shift during the pandemic in the surgical world, and what will continue, I think, is that the surgeons relied more on the nurses and the nurse leadership, and really they would seek our opinion on whether we should move forward doing a case. And historically speaking, that really didn't happen. If a surgeon thinks they should move forward doing a case, they want to do the case. And it didn't really matter what the nurse or the leadership team thought. Whereas in the pandemic, they wanted our input, right? I keep going back to unprecedented. Everyone needed everyone. All right, we all agree on this, right? As a team, we're agreeing that this is safe. We can move forward. This is okay. So I think that will continue. I think there'll be stronger collaboration between the different disciplines in the surgical world, right? And then it was a two-parter.
Just long-term impacts on the workforce.
Long-term impacts on the workforce. I think that we saw a lot of people leave healthcare, and the people that stayed are in it, and I don't think we saw whoever was going to leave left, right? I think that it made everyone stronger. However, it made everyone a little softer. I think you saw people be so empathetic towards each other, whereas you might have people complaining to stay late, but in this situation, someone has to go because of their child, or their mother is in a nursing home and has COVID, right? So people were just more empathetic and willing to have each other's backs. And quite frankly, and Joe would agree with this, in the surgical world, and why I was drawn to it and love it so much, is you cannot work in a silo. It's a team approach. And I always say, surgery is a team sport. Tennis players need not apply. So that was always, in surgery, everybody wins or no one wins, right? So the team has to be in sync, but it just strengthened everyone, and everyone was just so empathetic. It just brought everyone together. And I think that will continue, because now we talk about what's going on in your family and your home life and what are your stressors. And I think people are more at ease talking about it. We made work a safe place to be able to talk about it.
Right.
Had
Awesome.
to. Yeah.
Awesome. All right. So next is from another another alum, Dr. Napoli, from the famous cohort 1. He says your point about decision making in the context of uncertainty really resonated for him, and your comments about relying on principled leadership. And he comments that the rapid shifts during the pandemic probably also shifted your priorities, sometimes daily. You talked about, like, CDC said one thing at the beginning of the day and something different at the end of the day. Do you have any tips or thoughts or success stories on how you best communicated to keep your staff engaged and sort of all rowing in the same direction?
I think essentially leadership was more present. We were in, I mean, I don't think I put a suit on, and you guys know me for my suit and my heels. I don't think I put a suit on in 3 or 4 months. I wore scrubs and I went in, and so did my leadership team. We were back there. Even if we just sat there, just, I mean, so everyone would see us that we were there. I think that was,
Communicated a lot.
yeah, it may, if I'm gonna ask you to be here and I'm gonna promise you're gonna be safe, I'm right here if you need anything. And that was also a big change. We're, on any given day, you're busy. I try not to open up an email before I round, because once I get on my computer, I don't leave my office. So, but I don't even think I looked at emails. I was in the perioperative suite for 12, 14 hours every day. So.
Awesome. Let's see. Now, I think this next question is really talking about nursing staffing really sort of being the shortage being exacerbated during this time, and still nurses are being asked to do more and more in terms of billing, charting, and all of that. What's your view on how to free up nurses to do quality nursing care?
I don't think quality nursing care ever went away. I think nurses are incapable of lowering the bar. That's why they sign up to be a nurse. They, as much as I had to just set priorities. So I don't think that, quality was lowered at any point in time.
But given those stresses and sort of more and more administrative duties and shortage of staff, what's your strategy as a leader for sort of freeing up nurses to do more nursing care and less kind of administrative stuff?
Well, it's interesting because I don't think we have an answer to that yet, because we are spread so thin and people have not gone back in where we have enough people. We always talk about the triple aim and now the quadruple aim, access to care. We're seeing that reverse. We were making progress in access to care, but the pandemic, unfortunately, has taken us back, way back, where people do not have access to care. You can't get an appointment for months and months and months, and you might have a critical issue, right? And you may need surgery. You can't even get an appointment until the fall right now. So that's unfortunate, and that problem is not solved. And the only thing that's going to solve that problem is when people come back, or we have, we cycle back with more nurses and we're able to spread across spread the workload across again. But we're just going to have to prioritize. But again, it's not fair. And there are people who need care today and they're not getting it. That's just the hard truth of the matter.
Right. Yeah, there just is not enough people.
Right.
What's your thinking about allocating staff in terms of, or providing job responsibilities that really, there's a lot of talk about having people operate at the top of their license, so to speak. Have you been able to or think about shifting staff in those ways?
We have, we really have. We talk about it almost every day. So if we feel like, there's a nurse, say, one of your nurses who works in an office and, deals with insurance companies and the payers and things like that. What we did in the last couple of months is seeing a lot of these patients, especially with COVID, people don't want to stay in the hospital. Normally, maybe they would have stayed overnight, maybe 2 nights. They wanted to go home. They wanted to get out of the hospital. Who could blame them, right? So you have inpatient staff that we said, okay, well, how can we repurpose, right, their functions? So let's start training them when we can to do other things around the hospital. So whenever we have that opportunity, we do that. But that's just, again, that's just a landscape that changes every day. But we try to cross-training became a big thing during the pandemic for us.
Yeah, absolutely. And also helps you keep people employed.
Right.
I would imagine. Yeah.
And the other thing too is where you would never, you try to never say no when, you just have to shut it down, or you have not enough nurses, or you have to let that nurse go home because they are having a breakdown. They haven't slept. They have kids at home that are sick, or for any reason, you have to take care of them. You have to let them take care of themselves. So sometimes you have to say no, where normally no is not a popular answer, and you have to be able to say no. And I think during the pandemic, more people understood why you had to say no.
Yeah, for sure. So Henry, I would ask if you have any thoughts, given some of Kelly's reflections, that sort of lead us down the path of how we think differently about leadership going forward.
I just like Kelly's stories. Kelly, with great stories around how your priorities changed, and a lot of times those priorities were changed by who you had to talk to, that you were bringing in more people into your decision-making process. So that is that. How do we create that common purpose, or making sure we do have a common purpose? I really like that, and I do hear you. I love the cross training, because that's how we do build better integration. When people know several jobs, they know how to then do the handoffs between jobs. So I'm really excited about some of the things you were talking about with the cross training just in that last story were so critical. And I like that I'm hearing that everybody is pulling together and taking care of one another. I think that's the ultimate goal in the end of that one bucket of how do we make sure that we're taking care of ourselves so that we can be right on target when serving those patients and bring our best self to the job. I think that's we sometimes everybody's just so busy that we don't think about the other person. And I'm really encouraged by your stories around how we started to understand the human side of each other as well, which just builds trust, builds respect. And I know you're moving fast to get these patients in and take good care of them and get them out safely with the right process. But at the same time, boy, taking a little bit of extra time to know who's on your team and build that relationship. We really do in healthcare need to be expanding our networks to really be seeing the perspective of patient care from so many different angles. And I think that what I'm hearing from you and talking about your patients and your challenges, that you did broaden your network of who you consulted with, who you brought in to help make decisions, so that you made more robust decisions, even with less data, I'm sure. It sounds like you survived, which is with style. So I really,
I'm still standing, Henry. I'm still today. I am still standing.
All right, we have another question. Pretty much geared at Kelly, which is fine.
Yeah, that's good. That's what it's supposed to be.
How has the
leader in the trenches? That's who we need to talk to.
Right. We want to hear from people in the trenches. How has the pandemic changed your level of preparedness as a healthcare leader for future pandemics? Would you do anything differently if another pandemic or something similar hit? Like, how did, were you what did you learn in terms of like dealing with this amazing level of uncertainty? What if that happens again? Like what would you take away from this experience to do differently?
Well, it's interesting. I was a trauma nurse and for a while, and I've done CPR on people, right? So that when you live that life and you've had that experience and being a trauma nurse for a couple years, right? You are someone that can stay cool and calm and function in chaos, right? If someone came into my office and she said, "You were built for this," right? And I think that was week 2. She said, "You were built for this." And I thought, oh yeah, maybe I was built for I wasn't built for 2-3 years of chaos, right? So I think how I changed was because it did stay chaotic, but I didn't function the same in the chaos. And I think moving forward, that is what will benefit me because I became calmer during the chaos. It wasn't a trauma that came in a gunshot or a car accident. It felt like it for the first couple of weeks. It felt like that, but it just kept going. And you can't keep functioning high level with that kind of adrenaline rush. You have to calm yourself. So I think that's for me as a leader. Yes, I can function and I can work in trauma and the whole thing. And I know it's crazy, but our nurses and doctors who are in traumas would understand there's a certain thing that excites you about a trauma. Like, it's critical. You want to say it's life or death and you're going to save someone. That was how I felt the first 2 weeks. I could not sustain that level and make good decisions and survive through it if I did not adjust. So still chaos, but I had to calm my mind and my thinking.
Excellent.
If that answers.
Yeah, that was excellent. So we have time for one more question. It's from Dr. Pito from the quality course, one of our faculty. He asked, what was your biggest leadership surprise or lesson learned during the pandemic?
I think it was a disappointment, actually. It was a big disappointment. I think about it almost daily. I think there were some people that just threw their hands up in the air and would not make a decision, right? And I think I expected from at a leadership level a different response. I think that shocked me. I felt like I was on an island at one point and I was a lot of pressure. That just showed me that this is not about me, but if I have to execute and make a decision on my own, here's how I have to do it, right? So when normally you can go down your mentor list and call 10 people, right? And get good feedback. I couldn't find that. That was, I don't know if it was a lesson, but it taught me to be prepared and be ready to execute on an island when I had to.
Right. And what do you think that you did in terms of like if that was happening with your own leadership team, how did you try and work with them or coach them in terms of bringing them, back into the team, back into the fold?
See, that might be a question. I mean, I'll answer it, but my priority is, I have in my management career, I am on my 4th leadership team that I myself have interviewed, hired, mentored, worked with. So this is my 4th team. It's what I love most about what I do is building that team and mentoring that team. I learned from who I'm mentoring as well. So it's a win-win. My team was so close and trusted each other as a team. We were already functioning for what we needed, the level we needed to in the pandemic, I have to say.
Awesome.
Again,
A high performing team. Awesome.
I have a great team, but again, we're a smaller hospital, right? And we're very lean. So you're talking about 5, 6 people that make a lot of the decisions. Now in a 1,000-bed hospital, and you have multiple layers where maybe only nursing leadership meets in a room. I have a very diverse group, lean but diverse, which is by design for me, because I think people get narrow tunnel vision when they're in it. And sometimes someone who is not even a clinician can sit and listen to your problem and have a solution right off the top of their head because they're not in it. But I think I was prepared team-wise. You have to, that's my number one. You have to trust your team. You cannot run a healthcare organization with people that you don't trust. And I mean, it's so important. You build your bench from the day you walk in the door. And that's what I always did. And I think for people who aren't doing that, I would start today.
Start today.
Because then you're not alone, you know, so.
Right. Henry, did you have any other observations on that?
No, it's a beautiful story. I think that that's the answer. We have to start thinking about talent and who you're bringing with you and how you grow it. Because if you don't trust the people you've got around you, then you're right. You can't function. You are alone on that island, and it is a very scary place to be. So good. Congratulations to you to build it, to know that team was so critical for success.
Thank you.
All right. I want to thank both Henry and Kelly for your amazing contributions to tonight's conversation, and look forward to hearing more from you and others throughout the months coming up. We plan to have a session at least once a month to continue to engage our alums, our prospective students, faculty in a great conversation, because it's all about how we lead and lean in to go forward in healthcare. There's lots of challenges in healthcare and lots of ways we can use our leadership skills to make an impact. So really grateful to both of you for helping to join in this kickoff conversation, and would let all of you know that our next session is next Tuesday at the same time, 7 p.m. We will be having Jim Austin, one of our other faculty members, talking about execution. Kelly mentions, making the decision and getting ready to execute. So Jim is going to focus on executing strategy, and he'll be joined by Shannon Sullivan, who's an alum of the program and who's the Chief Operating Officer of Women and Infants Hospital here in Rhode Island. So please join us again for the discussion next week. We'll look forward to seeing you all in this space again. Thanks so much, and have a great night.
Thank you, everyone. Good night.
Good night.